This is Carol, and we were originally talking a little bit about some symptoms you were experiencing not too long ago, a couple months ago, right?
Yes.
Tell me a little bit more about that. You were on a ski trip.
Yeah, I've been having some left-sided jaw pain,
Okay.
and just intermittently noticed that it was aching me.
Okay.
And then I was, skiing and in the mountains and just casually having lunch with friends and eating a sandwich, and I bit down and had quite a bit of pretty extreme pain on my left jaw area, and I just kind of stayed quiet, and it gradually diminished. But when I came back from my ski trip, we had an appointment just for a general appointment,
Right.
and I mentioned it to you, and you had mentioned, well, let's keep an eye on it, and if it doesn't go away in 2 weeks, then get back to me, which I did. I think I got back to you after a month. I wanted to make sure to see, if I could tolerate it a little bit longer. And in that time, I iced it and read a few things about this TMJ problem, which I thought I had. But it wasn't until I came back to see you that this process started.
Nice. So tell me a little bit more about the pain. Kind of describe, was it like a muscle pain? Was it a joint pain? Was it a tooth pain?
It's really a muscle kind of joint pain, I'd say. It was quite sharp and dull. I was sharp at that one moment and when I was skiing, but continued to be rather dull and constant,
not going away.
No, and it wasn't comfortable to chew on that side, so I had to chew on my right side.
Got it.
A pretty long period of time.
Okay, fantastic. All right. Well, we're going to go ahead today and check the muscle activity. That's the big thing. Is the bite has a large muscle component to it, right? And so when the muscle starts to spasm, that's usually where the pain and discomfort comes from. And so today what we're going to do is measure the muscles as well as how the teeth come together to make sure it's coming together in a healthy way. Because if that timing is off or that uniformity is off, we can get some dysfunction, and that can result in the symptoms that you're experiencing. So we'll go through a thorough diagnosis and then treat any issues that we see.
Okay, sounds good.
Perfect. So Carol, what we're going to do is we're going to be measuring the sounds in your joint. And so that's going to help us detect if there's any inflammation going on in the TMJ.
Okay.
All right. Actually, the reverse. Instead of you listening to the headphones are listening to you. Open, close, 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 open, close. Okay. All right. So we've got some noise in the joint.
The first part, I wasn't clicking my teeth.
That's okay. It cycles. I just need a couple good cycles.
Okay.
So you see these big amplitudes here? This is you closing, right? So you see that right there. And so what I'm looking for is anything in between, right? So here I've got some noise in the joint, okay? And that's on the right side. On the left side, I've got quite a bit of noise. So this is open as it comes down and then close right here. So on the closing, we're picking up quite a bit of noise on the left TMJ.
Oh, okay.
So that could either be inflammation or the disc slipping on and off the joint. Anything along those lines. It's pretty consistent. This is a close here, even though it's a little bit off on the metronome. We can still read it because that close lets us know when you're closed. So on that closing, you've got a good amount of joint noise on that left side. That's the left TMJ there. So we're going to use that to kind of track our changes. At the very end, we'll have you do this again to see what the joint noises are on that aspect. Okay, bite down, squeeze, and then grind toward me. Open.
I think I did it.
Let's take a look here. So this is right when your teeth come apart. So as we're moving
to the right side. Let's see what happens. So when you're moving to the right side, you're getting hung up on
The left. Yep.
the left. That's why you're having a hard time moving. You're hung up right there on the left.
Your muscles are having to overpower your natural reflexes. And so, because it's taking so long to do that, that's why the muscles are spasming, because you can see also from the EMGs, you've got a lot of muscle activity going on, quite a bit here.
That's on the right side?
That's on the right side, so it says, you see the R right there?
Yeah.
And the
So
L
it's
right there, it's
trying.
pretty small. Yeah, it's
I can't do it.
it's trying, but it can't do it. So you're just getting hyper, some spasms on the right side.
So it's really weak.
Mm-hmm.
Yeah, okay.
Well, not really weak,
Not weak.
just
Fatigue.
fatigued.
Oh, okay.
That's what
That
I would
would be
say.
better,
So
right?
it's not like it's not anything wrong with it. It's just overused. So I'm gonna go ahead and have you do the same thing, but to the left side. That's your easier side.
Okay.
All right, go ahead and open there. Okay, bite down, squeeze, and then grind to the left and open. Awesome. Better to the left. Still have some interferences. Okay. And you got even more muscle activity on that left temporalis.
I know, there's like skyscrapers in my middle.
Right.
Really
I mean, that's like New York
illustrate.
City. We want more like Carlsbad. Right?
Yes, everything Carlsbad.
We want more Carlsbad. So yeah, you're New York City right here. We want more Carlsbad.
Go big.
Yeah, you know that tooth is loud and proud, right? So we gotta correct that. So that's where the beauty of this technology is. Just looking at you, have no idea, right? And so we run you through these different scenarios, and every time tooth number 15 lights up.
Yeah.
So that's the most obvious tooth to adjust, and so we'll go ahead now and adjust that tooth.
Okay.
And we'll just kind of work with it and work through it, and you'll be noticing some bite changes happening. Like I said, no needles or shots or drilling or anything like that. Okay. So I'm going to go ahead and just check your bite here on that left side. Open there. A little bit of air here. Okay, open. Oh, you got that gold crown on the bottom and a big filling on the upper. All right. Tap, tap, tap. Open. Yep, and there it is. There she goes. Nice big interference. I can see exactly what's happening there. So, we'll go ahead and adjust that. So I'm going to kind of split the difference a little bit from the lower, a little bit from the upper. Here, go and open there for me. These spots there. A couple little crowns too. Open. Better. Everything's starting to center,
Yeah.
right? Because we started getting rid of some of those interferences on the side, so your teeth don't crash together, they come together. Yeah. And then like you're feeling teeth touch that have never touched before, and it just feels even. Yeah.
And when I bite down, it doesn't hurt a lot. Before it hurt.
Right.
I'd bite down and
You'd have
it
the
would
pain.
hurt right there.
Got it. So we're already
So now I'm
starting
not
to see.
feeling the pain when I clench down.
Nice.
So.
Okay. Good deal. It's pretty awesome to see things
Yeah.
happening within seconds.
Yeah.
You know, as far as how long it takes the body to heal, and that's neurological healing, which is pretty cool. See that? All right, so
That
now we're
is
going to do the
amazing.
left side.
Okay.
So, Carol, we got done with about 45 minutes of adjusting. We noticed some tremendous decrease in muscle activity. What does that feel like to you from the patient perspective?
Well, right now when I bite down, I feel my teeth surfaces definitely more equal, whereas before it felt just completely off. You
Okay.
know, they weren't touching
Right.
at all.
Right.
So that I'm feeling, and I'm not, when I bite down, I'm not feeling pain.
Good. And because
At
you were
all.
having that pain in that left
Yeah,
jaw.
in the left side.
Yeah.
Uh-huh.
So on a scale of 1 to 10, what was that pain like for you on that left jaw when you first walked in? You know, where were you at
Gosh,
on a scale of 1
could
to
have
10?
been a 7.
7. So pretty significant. It's interfering with daily life. It's on your mind. So
Yeah.
if you're walking around, you're maybe
80% of my day for
and
sure.
maybe sitting
70,
in,
80%.
I guess, mass at Easter service, you'd be thinking about it, right?
Yeah.
Okay, significant
Notice
enough,
it's there.
noticeable. You know, you're thinking about other things, but pain is present,
Yes.
right? So now, after we did those adjustments, and you're biting down on a scale of 1 to 10, where is that pain level?
Biting down, I have no pain.
0. Would you call it a 0 or 1, or are you feeling anything?
0.
0.
I have some just when I release my my bite, I have some just soreness that's still there,
Got it.
but nothing with biting.
Nothing with biting. That's awesome.
It
And-
is. It is. Thank you. Thank you.
It's a relief, right?
Yeah.
Kinda like I think we talked about earlier, like taking off a tight shoe at the end of a long day, right?
Right.
Just you got used to it for however many months
Yeah.
you were dealing with it, and then now we've released that, and now it's not. It's the pain isn't even on your mind.
No, it feels like now maybe it'll just heal, like you were saying about the
Yeah.
twisted ankle or whatever, the ligaments or whatever is sore. Maybe that'll
Yeah.
in time go away.
So perfect. Yeah. Well, that's great. What
It
a
was
great result.
a good result.
So yeah, was there
Thank
any
you.
pain during the procedure or anything like that?
No.
Did that
there's
hurt you at all?
No discomfort.
No discomfort,
No. I mean, out of the ordinary.
Nothing out of the ordinary, yeah.
Just, thank you for your help to
Of course.
know how to
manage
move
it.
my jaw right and left because that had shut. Moving it to the right was difficult.
Yeah.
Yeah.
Yeah. Well, especially since you've been locked in, your brain was just trying to protect your muscles.
Yeah, I couldn't do that. So the mirror did help, but
Good deal.
hopefully I'll be able to do that better now when you
You're
ask
fine.
me.
You did fantastic. You did absolutely amazing. So.
Yeah, thank you.
Well, good deal. All right. Thank you so much.
Oh, thank you, doctor.
yeah,
Appreciate it.
absolutely.